So John Deitch, Wellspan Sports Medicine Medical Director, here on our last session of our virtual series. You know, it's hard to believe it's been 8 weeks since we started this series, and as you know, if you're following the news, so much has changed over the last couple months for all of us. We see us moving towards what is a new normal, at least for a while, in regards to the coronavirus, and we're going to need to continue to work as a team as we look at school and sports reopenings. Some have already. Tournaments are being played locally and across the U.S., but with a really different look and a different fan base. And that's going to be what we'll be dealing with at least through the fall of 2020. Now our goals at the beginning of this series, you remember from session 1, so we wanted to help you build a strong fitness foundation for your sport. And over the last 8 weeks, you've gone through a series of workouts that were no doubt challenging. And I want to just take a step back and say, anywhere along the way, if you were challenged by those exercises, that's a good thing. That's a good thing. We made those programs a little bit difficult so you know how you can work to get better. We also taught some techniques to make those programs a little bit easier as you go and build that foundation of fitness and do it in a safe way. I want to make sure you remember that if you've had a sports injury, an ankle, a knee injury, a ligament reconstruction, a shoulder issue, where you've had surgery, where you've had an extended rehab course, you need to understand that injury, and you need to work with our colleagues to help with the exercise modifications, with the gradual progressions that will get you where you want to be. You know, we talked about refining some skills at home, and we showed you some techniques where you don't have to be in a gym with a ton of equipment to get a tremendous workout. You don't need ladders, you don't even need cones. You need yourself, most of the time a flat surface, and a little thing called some effort and some drive, and some persistence and some determination. And if you followed through this series, we certainly know you have that. And we wanted to give you the opportunity to ask some questions, and I loved in the series some questions that were answered on topics that we covered. And so just to review, you know, what we did cover, we said, first of all, you need 3 things. You need a foundation of fitness, you need some good sleep and nutrition and hydration. And in the first week, Beth Conway really talked about nutrition. And on our website and through this series, please take a look at the nutrition facts to eat up. Tremendous recommendations for athletes and their individual needs of both nutrition and hydration, the balanced variety and quality of your diet. What's your primary energy source, and the fact that you all need to use a balanced diet that includes proteins, fats, and carbs. And no one is immune from an eating disorder, and you are your teammates' best possible help. If you see eating patterns change, you need to let the parent or coach know. You know, our mental health and understanding the mind-body connection was huge, and both Dr. Briarcheck and Dr. Crawford spoke to that. So practice mindfulness, reframe those situations, practice gratefulness, and those relaxation techniques can allow you to relax, have fun, and really do your best at your sport. The ABCs of sleep, I love it. Some key ones. You need 8 to 9 hours of sleep. I don't really care how you get it, but you need to incorporate that in to be performing at your best. And fatigue from lack of sleep is a leading cause of injuries in sports and adolescent athletes. So try to keep a routine sleep schedule for optimal sleep and performance. Turn off those cell phones and those devices an hour or 2 before bedtime. And vitamin pills and caffeinated beverages never replace good sleep. We then touched on a really important topic, substance misuse, and understanding that trying drugs, trying things like vaping, trying things like Juul is not a good idea for athletes. We even gave you an out, what to say. Hey, I've got practice tomorrow morning, really don't think I should. and be able to walk away, and also recognize the signs of substance abuse and misuse, and understand the consequences that could have for your family or your friends. We focused on posture and breathing and how important they are in sports performance. Controlling breathing is going to allow you to have increased energy to be able to get through the workouts. And to control your breathing in competition is a way to be successful and calm and move forward. And we went on to how we actually prepare to play and train with active warm-ups and injury prevention programs, understanding that dedicating that time, investing that time each week is going to make it, is going to be critical for your overall performance and your ability to stay on the field and out of the training room and out of the operating room during your career. And we gave you some key techniques to use, or some workouts to invest in, one such as FIFA 11 Plus. And finally, we touched on the return to school and sport guidelines. There are new recommendations. Your practices and your school events are going to look different, and it's going to take everybody's buy-in, from cleaning procedures into personal things like hand hygiene, no equipment sharing, showing up on time, being honest with symptoms if you have them. We want to make sure you are keeping yourself and your teammates safe. We know starting in just a couple weeks, PIAA pre-participation physicals are going to start, and they're going to look different from how they've ever looked before. There'll be sign-in times online. You'll need to show up dressed, ready to go. Forms will need to be completed. Your parents or guardian, only one will be permitted in a building at a time, and there's going to be a one-way flow of traffic in and out. So although these things are different, they're not necessarily bad. So we asked you to read carefully and prepare for those events before you show up. Our team, our entire team, is committed to working with you on the organizational health and safety plans of your school, of your youth sports organization, and your teams. And if you even have questions related to you or family members, you need to be comfortable reaching out to us. And you can reach us via our website at wellspan.org/sportsmedicine, where if you have questions about anything, any workouts of the series, any talks of the series, please reach out to us via the email address you can see on your screen right now. And finally, and probably most importantly, are the thank yous. The thank yous to my team, to Jess Kuntz, DPT, for really leading this effort, to Zach Miller and Laura Free, our exercise physiologists that took everyone through these workouts, to our Wellspan Sports Medicine family that now crosses west to Chambersburg and east to Lebanon. They've all had a big part of this and have brought their knowledge to you. Our Wellspan Rehabilitation, Wellspan Nutrition Services, and Behavioral Health specialists, as well as our sleep service colleagues. We have a team in place to care for all your needs, and we care for the athlete in all of us in every part of your training program. We couldn't put this program together either without IT services and Kyla Enzer, who's been running our Zoom meetings, our public relations and marketing team that helped us with the website links, and a special thanks to the students, colleagues, and Wellspan Sports Medicine fellows that all put themselves on the line as part of the video series. And finally, I'd like to thank Cody and the entire team at York Revolution for being great partners for us in this video series, for all the hours they spent helping us tape the series for the use of People's Bank Park and their partnership now and moving forward. We can't thank you enough for the time you put into this and for the lives and the athletes you've made better because of your commitment to this program and their well-being into the future. So with that, let's close down the series. We're here for you now, as always, and have a great fall season.